I'm Sue DeSalle, I'm the Harwich town nurse. I've got some company here today, a little medical information for everyone. Something to think about for while you're not awake. I have here with me Dr. William Shire and Ruth Vout. I'd just like to introduce the two of them as our local dentist and sleep apnea clinics. So if you want to just introduce yourself as far as your history here on the Cape.
Great.
And your thoughts on the sleep apnea treatments, and we'll just kind of...
Good. Well, good morning. I'm Bill Shire. I've been practicing on Cape Cod in Orleans for 25 years plus now. Been doing the sleep apnea and snoring treatment probably for that length of time, but more specialized lately in the last 5 years to working closely with physicians in helping them gain better treatment options and treatment results with their patients who have this disease. Interesting fact is that a lot of people don't even know that they have it. And a lot of times their physicians don't even quiz them on whether or not they have the symptoms relative to it. So I'm sure we'll get into what all that's involved at some point.
It is certainly difficult. I know that when people come in, you're always thinking about them as a whole person. And I know that when you go into your doctor's offices, you're trying to think about this person as a whole. Mm-hmm. But insurance is mandating such short visits that you don't have time to get into every issue that's coming your way. So what is obstructive sleep apnea?
Obstructive sleep apnea is a disordered breathing when a person sleeps. It is either the partial or complete cessation of breathing for a certain period of time, which decreases the oxygen level that a patient is able to inhale when they're sleeping, so that their oxygen level in their blood and thus their brain and other organs decreases to a situation where it becomes a medical issue. Mm.
So when they're sleeping, are there different levels of sleep apnea?
Oh yeah, sure. There, anything from mild to severe, depending on how much time that person stops breathing or how much their blood oxygen level decreases. The interesting point is even mild amounts of sleep apnea can have serious side effects depending on the patient's other medical situations. So even something that's barely detectable can have major ramifications on your overall health.
So Ruth, if someone were to come into you, why don't you share with us your roles there?
I'm the patient care coordinator for the Snoring and Sleep Apnea Treatment Center, and I've been doing this work with Dr. Shire for a little over 3 years now, and I'm a hygienist, but this is a whole new chapter for me, and it's really rewarding to help people.
Yeah.
Because it really changes lives in a great way.
And I know you get to know your clients very well. And so if someone were to come in and mention something to you, at that point, like what type of conversation would you have with them if they were to come in and say, I'm always tired, or have some concern or question about sleep apnea? What direction would you next, what would be the next step you might take with them?
Well, generally we go through a screening process with our patients, and we ask them a little bit of their history, like how often do you feel like dozing in the course of a day? Or do you feel like dozing when you drive, or when you watch TV, or when you're in a meeting, or...
kind of the level of sleepiness.
Yeah, level of sleepiness, exactly, as well as how sleepy are you during the day? Does it affect your quality of life?
Okay.
So we start with that, and then always ask, have they ever been treated for sleep apnea?
Okay.
So then we proceed from there.
Okay, thank you. So what would some of the symptoms be? And feel free, either of you, to kick in, but I know that some of you listeners out here might be wondering, oh, do I have sleep apnea? Or I think that my bedmate might have sleep apnea. What are some of the symptoms? So if you're concerned about someone, what are some of the symptoms you're looking into for yourself? And it might be those that you just mentioned, or for your bedmate.
Okay, so the symptoms can vary from male to female, as well as just overall. But they certainly are commonly loud snoring and witnessed apneas, which is a person literally stops breathing.
So you might feel like you might hear them breathing in a normal rhythm. So as if you were to count 1, 2, 3. So there'd be a little break in the way of which you hear them breathing.
That's true. That's exactly right.
Yeah, and it
But
can be
believe
scary.
it or not, it actually lasts a lot longer than
Yeah.
that.
Okay.
It's actually almost to 10 seconds.
Oh, wow.
The
Yeah.
silence of no breathing
Right.
can wake up your bed partner, and it,
Okay.
So
know,
those are symptoms. Also, waking up yourself, gasping for breath, or
Okay.
waking up with a headache.
Okay.
As Ruth explained, excessive daytime sleepiness is very common. Those are mostly the symptoms. Some of the signs are, which relate to other illnesses, are these can tie in closely with other illnesses such as high blood pressure, heart disease, diabetes, even Alzheimer's. Irritability during the day as well. So
Yeah.
there are a lot of
Forgetfulness.
yeah,
Yeah.
absolutely, yeah.
Okay.
So there are a lot of things that might key the thought process that maybe I should be tested for this.
Yeah.
And those are some of them.
So certainly these are going to be symptoms that make you feel like you're not your best self. So even if you have these symptoms that we've discussed, it could still be a myriad of different things.
Yeah.
And your medical doctor is often a good person to go to and start with.
Correct.
But if you are seeing your hygienist and visiting with your dentist and discussing some of these things with them too, just to know that if you're not feeling like your best self, bring it up to the doctor and have some discussion, open up a dialogue, and just see what else it might be. So who do you get some of your referrals from?
We get a lot of them from local physicians. We work closely with PCPs in the area and the actual sleep medicine doctors in Hyannis, who are normally either ENTs, ear, nose, and throat specialists, or
Yeah.
cardiologists who are guys who get the connection between sleep apnea and their patient's heart disease.
Yeah.
So those are the ones that will refer to us with people who are already diagnosed. A lot of times we get patients referred from PCPs to help determine whether or not they need to have a diagnosis and who's going to do that diagnosis
Okay.
and how it should be best handled. Again, as you mentioned before, with our medical model in our country now, everything has to revolve around the insurance companies to some degree.
Yeah.
So we feel we have the best capability to be able to advise people how to do that in a most expeditious and cost-effective manner through their medical insurance and keeping their physicians in the loop.
Which having someone like Ruth is quite valuable to you.
But sometimes we get people that just walk in off the street. They know about it, or they see the sign and they know they have a problem with
A concern to
yeah,
start with.
and so they come in and they say, "Can I be seen?" And of course you can. We don't need a referral.
Yeah. Okay. So you can walk in. You
Absolutely,
can
or call. Yeah.
Oh, sure, yeah.
And we'll give you the numbers at the end of the program. But so Ruth, you would also work with the doctor that referred them, and you would help them go through insurances.
Yep, absolutely. We send letters from start to finish.
Great.
When a patient comes in and we think they're a candidate for the appliance, which is customized to each person's mouth.
Okay.
Then we'll send a letter to their physician and cardiologist and ENT.
Okay.
All that gets communicated very clearly.
And I know that when you're trying to deal with any kind of diagnosis out there or try to deal with the insurance companies, trying to put it all together and be your own case manager is nearly impossible. So having someone like Ruth in your office, having someone that's going to connect all the pieces together is a vital piece. So even if somebody wants to have it, if they don't have someone to help them put it all together, you can't even have the device that you're looking for.
And we work closely with each person to ensure that at the end of treatment or during treatment, we're reaching the goal of therapeutic
result.
Yeah, and I'm
result.
sure there's plenty of follow through on your end once
Absolutely.
they've gotten it started. Okay, so what are the treatments for sleep apnea?
Okay, so once diagnosed, there are generally 3 ways to treat it. 3 ways to get you to breathe better at night or to get oxygen into your lungs so that it gets into your bloodstream. The first and most common way is what's called a CPAP machine,
Okay.
which is a fairly intrusive device where a mask is placed over the face or on the nose, and air is forced into through the closed tube, if you will,
Yeah.
into the lungs. And it's literally at about 20 miles an hour.
Oh, wow.
So it can be irritating. It could be kind of a claustrophobic feeling.
Yeah, just having that mask on your face.
Having the mask on your
Yep.
face, as well as the noise that it creates for your bed partner, as well as you,
Having
and,
the machine at the
and a hose
bedside.
wrapped around you.
But it
Yeah.
can be your best friend if it's giving you
If it's giving you
Air.
life. Yeah.
Right.
some
If it's
Sleep.
breathing
Yep.
life into you while you sleep at night.
Correct.
So that's the most important.
And for the people that cannot, and I do come across many people that cannot tolerate that
Right.
CPAP machine,
That's where we come in.
that's where you come in. All right.
Absolutely.
So people who are CPAP intolerant, which the latest studies show it's as high as 80% of the people prescribed CPAP cannot tolerate it.
That's just an alarming percentage of people
So,
that can't
right,
manage
no, I
that.
agree. So that in itself, knowing that to me is
You want to help them.
yeah,
Right.
Yeah.
we want to help. So the other 2 major ways are for us to make them a dental device, which is a mouth guard-like appliance that slightly moves the lower jaw forward and slightly open. It's custom made and adjustable to bring the soft tissue of their throat and back of their mouth forward to open the airway so they can breathe naturally.
Okay. So
And that's our main focus.
yeah, so we were talking earlier before the program, and Ruth was made a very good point that I could visualize. So when you're dealing with weight loss, and you do hear sometimes weight loss helps with sleep apnea. What are your thoughts on that?
Well, when a person isn't getting enough oxygen when they sleep, which is a lot of time, it you become excessively tired, and it's just a perpetual cycle that just is very negative, if you will. So with treatment, a lot of times people get more energy, they feel better, everything just turns into a positive direction, and a lot of times weight loss occurs and also changes the anatomy of your oral tissues in this throat area. So
So the pressure of the soft tissue when you're laying on your back that's resting on your airway, that
Exactly right.
soft tissue is then
collapses and
Closing,
Yeah.
closes the
Closes
airway.
down.
right. So if you lose some weight, sometimes that degree is lessened.
Absolutely.
And
Okay.
we hear this all the time, and we have patients that have, they come in at the start, and then in, say, 6 months' time, they've progressed to having lost 40 pounds, just
Yeah.
because they have the energy then to exercise, to
So what came first, the
feel
chicken
better.
or the egg?
They're tied in
Exactly.
closely.
So,
correct.
trying to just get some more air, oxygen at night,
Right.
literally,
They're-
helps everything else.
It's very sad when
Yeah.
you see people come in. They're just so tired,
Yeah.
and they want help.
Yeah, it's nice to be able to help them, huh?
It really is.
It is. We even notice other things relative to that. People can actually come in with a hunched forward head posture because their throat is so closed that they're trying to open their airway. Subconsciously, they put their head into a different position. So there are a lot of ways to pick it
And
up.
that's one of your assessments.
Sure,
They
absolutely.
may not be aware of it, but it's something that you see.
Correct.
So-
the-
If they want to find out a little more information about this, what would be the first step?
Well, the easiest way is to give us a call,
Mm-hmm.
and we would ask them a few questions about where they might be on the spectrum, whether
Mm-hmm.
they think they might have it, or they think their husband or wife may have it, or partner may have it.
And they can have a good open conversation
Yeah, we
with
could
you.
just
Right,
talk.
and then
Yeah.
we'd have a clinical questionnaire discussion with them, and then say, okay, you should probably come in for a consult appointment, and we can see what your medical insurance is, who the physician is, how to best coordinate you getting finding out what a diagnosis.
Okay.
And so that would be the easiest way. They can also go on our website, and there's a questionnaire on that as well that they could access. It's probably the simplest way is to make the phone call, though. and
Okay.
come in.
So Jamie's going to show us the website information and just basically put up like a business card
Okay.
if you're interested in contacting them. But if they want to call you, what is your phone number?
The phone number is 508 area code 255-2511.
And could you repeat that one more time?
508-255-2511.
Great. And also, you can give me a call anytime for this or anything else, even if you want to have a discussion with me before you call someone or want to present it to your primary. Certainly always give me a call. You can contact me through the Council on Aging by coming in, or you can call my line at 508-430-7505. Again, 508-430-7505. And I am just so thankful that you're giving up your time to come in here and help us educate our public, because this is a big topic and it's something that's still kind of hush-hush. Nobody wants to say, I snore.
You're right.
Yeah, right.
I think I need help. You know,
That's
nobody
right.
wants to do that. But if they come in and talk with you, it's not invasive, and certainly you've got a way to make them feel very comfortable. So thank you very
Thank
much.
you.
Well, thank you
Thanks
very
for
much
having
for the
us.
opportunity, and we're just here to try to help people and get a better result and feel healthier, feel
All
better
right.
about themselves.
So Dr. Shire, you're in Orleans and right here, and you've been local on the Cape a long time. So thank you very much.
Appreciate it.
Thank you,
Alright.
Sue.